Okay, so let's continue our lecture on inborn errors of metabolism. Let's continue our lecture on inborn errors of metabolism. So we were on alkaptonuria. So excess homogentic acid and related compounds are deposited in connective tissues, which causes cartilage and skin to darken. Over time, a buildup of this substance in the joints leads to arthritis. Homogentic acid is also excreted in urine, making the urine turn dark when exposed to air. So you see, abnormalities in phenylalanine and tyrosine metabolism leads to this dark urine. This condition is inherited autosomally recessive in an autosomal recessive pattern, which means both copies of the gene in each cell have mutations. The parents of an individual with an autosomal recessive condition each carry one copy of the mutated gene, but they typically do not show signs and symptoms of the condition, so they are carriers. So the parents of such a person may have, yes, let's say if this is the alkaptonuria gene, capital A, and somebody having the small letter is recessive. It's not recessive. Somebody having the small letter is recessive, but that's what carries the disease. Then we map it. So this coming here, this also crossing with this, and this also crossing with this. So this is a normal parent. Normal parent. Diseased parent. So we have A. Okay, so let me change it to this. So they are carriers. Both parents are carriers. Both parents are carriers, meaning that they don't have the phenotypic expression, or they are not showing the alkaptonuria. They are carriers. They are not showing, they are not having the disease, but they carry the gene for the disease. So we have this. Small a means the disease. Capital A means normal. So this one will cross with this. So we have AA. This one also A, small letter A. A, small letter A. And here is small letter A, small letter A. So this one is what? 50%. That's 2 out of 4 is 50%. That's the prevalence. This is 25% is because the A, capital A is only 1. Then the disease is what? 25%. So this is the disease, a sick person with alkaptonuria, and this is normal. Normal person, and this person is a carrier. These two people are carriers. They have the gene, but they don't have the sickness. So they are carriers, like sickle cell carrier. The parents of an individual with an autosomal recessive. So this is an autosomal recessive. This is a recessive, so it is autosomal recessive. It's in the body cells. The parents of an individual with an autosomal recessive condition each carry one copy of the mutated gene from the mother and the father, but they typically do not show signs and symptoms of the condition. That the parents will carry, they are carriers. They have the normal and the recessive, which is the disease gene. So the parents are carriers, but they will give birth to a baby who is sick. So this is homogenetic acid structure. How is this condition managed? How is IEMs or inborn errors of metabolism managed? In the middle of the 20th century, the principal treatment for some of the amino acid disorders was restriction of dietary protein, and all other care was simply management of complications. In the past 20 years, so restriction meaning that you don't give such a person having that gene defect a diet that contains those amino acids, because they cannot be metabolized. Then other management procedures are that if the person has already taken the amino acids, you have to manage or reduce the complications associated. If the person is having bloatedness or diarrhea, you give the person antacid. It's a drug that reduces the acid content in the gastrointestinal tract. In the past 20 years, enzyme replacement, gene transfer, and organ transplantation have become available and beneficial for many previously untreatable disorders. So we also have what? Those who don't have the enzyme, you have to buy the enzyme from enzyme manufacturers or pharmacy shops and others, because they don't have the enzyme and they want to take in milk. You don't want them to develop diarrhea and others. So you give them, go and buy enzyme which is called lactase, so that you take in the enzyme, you take in your milk and take in the enzyme lactase to break down the milk for you. We also do gene transfer. You take a normal gene, put it in somebody who having the deficient gene, so that the normal gene will work in the person. Organ transplantation meaning that those with leukemia, they are having problems with their bone marrow. So you do bone marrow transplant. If the liver is not working due to inborn errors of metabolism, you have liver cirrhosis and others, and the liver cannot work again, you go and buy a liver from South Africa or Europe. South Africa, if you go there, they have a lot of liver that people have donated before they died. They donated it, or their family donated it, and they are having them they are having them a lot in organ banks. So you go and buy the liver and come and put in your relative who is having liver problems. So like I said earlier, on dietary restrictions, you don't allow those people to eat diets containing proteins. Then those who don't have those enzymes, you give them diets that contains those enzymes, or you give those who are having hypoglycemia, meaning low glucose level in the blood due to diabetes or the pancreas not working, you give them cornstarch several times so that it will not prevent them from collapsing due to low glucose level or hypoglycemia. You can also administer vitamins supplementation to treat lactic acidosis. Intermediary metabolites, compounds or drugs that facilitate or retard specific metabolic pathways can be taken. Dialysis is what happens, when somebody has a kidney failure. You go to dialysis, means that you are washing the dirt, you are washing the those unwanted metabolites like uric acid in the blood. Those who have kidney problems, they end up building urea, creatinine, and uric acid in their blood. So they end up dying so fast. So there is, when you go to teaching hospitals, Tamale, 37, Kolebu, Kompanochi, they have dialysis machine that such a person will go and the dialysis machine will remove all the nitrogenous waste from the body. But he has to go about 3 times in a week to remove all those nitrogenous substances from the body. And just a week, you end up paying about 1,000 Ghana cedi. And it is so expensive. So if somebody has about 10 years to live, every week you are paying 10 million a month you are paying 10 times 4, 40 million. So if you have 10 years to live, then 40 times 10, that will be what? 400 million. No, a month will be 40 million. A year will be what? 120 million. 10 years will be 120 million times 10. Too much. So some of these things, when people have kidney problems, the families, they keep quiet and let the person die because they can't afford. So enzyme replacement, so acid alpha glucosidase for pump disease, gene transfer, as I've already explained, bone marrow or organ transplantation, I've already explained. This happens in leukemia when the person is having cancer of the bone marrow. You replace with somebody who does not have that condition and is dead. You go there and go and get the bone marrow and replace it. Treatment of symptoms, if the person has already taken the food that is making the person have the symptoms, you give drugs or food and medications that will reduce the complications. Prenatal diagnosis and avoidance of pregnancy, meaning that if somebody is pregnant, prenatal means that you are pregnant. Postnatal is what? After delivery, and prenatal is before delivery. So if you diagnose somebody with inborn errors of metabolism, then what we need to do is to avoid the pregnancy. Because if the baby is having inborn errors or the mother is having, you have to avoid the pregnancy or cause abortion of the fetus. How do we diagnose inborn errors of metabolism? One, we have the quantitative measurement of amino acids in plasma and in the urine. I guess you know what plasma is and what serum is. We'll teach you in hematology. Urine organic, the plasma has clotting factors, but serum does not have clotting factors. Urine organic acid analysis by gas chromatography or mass spectrometry. Plasma acyl carnitines, this is what is used to remove excessive fatty acids from the blood. So when you are analyzing, carnitines are just proteins that bind to fatty acid. Acyl, the acyl groups of fatty acids, long chain fatty acids. So this can be quantified using the mass spectrometer. Urine purines and pyrimidines analysis using the gas chromatography or mass spectrometer. Dozens of congenital metabolic diseases are now detectable by newborn screening tests, especially the expanded testing using mass spectrometry. This is an increasingly common way for the diagnosis to be made and sometimes results in earlier treatment and a better outcome. There is a revolutionary gas chromatography mass spectrometry-based technology with an integrated analytic system, which has now made it possible to test a newborn for over 100 genetic metabolic disorders in Ghana. Because of multiplicity of conditions, many different diagnostic tests are used for screening. An abnormal result is often followed by subsequent definitive tests to confirm the source. Meaning that when you test and you get an abnormal result, you have to do a higher test to get the actual results. Tissue biopsy or autopsy, necropsy is the same as autopsy. Biopsy is when you want to study a tissue, you take a small section of the tissue. In the human being, you use a core biopsy needle to take a small section of whichever cancer cell, whichever tissue, like the liver, the muscle, the brain, the bone marrow, and do what you call histopathology to find the diseases associated with those tissues. Skin biopsy and fibroblast cultivation for specific enzyme testing. We can also do DNA testing. Thank you very much.